Welcome back to the Our Invite podcast. My name is Nima.
My name is Aaron.
And today we're joined by a very special guest, Dr. Ali Golshan, a board-certified fellowship-trained vascular interventional radiologist. Dr. Golshan got his doctorate degree in UCLA School of Medicine. He completed his residency in radiology at UCLA, and then he went ahead to complete a fellowship in interventional radiology at Johns Hopkins University. Thank you so much for joining us, Dr. Golshan.
Hey guys, thanks for having me, Nima, Aaron. Really a pleasure to be on the show. And my name's Ali. Feel free to call me. Okay. And really happy to be on the podcast. I think that I enjoy talking to other people about my journey. And at the end of the day, I don't think we know where we're going to end up when we're in school. And as the types of people that go into healthcare, we tend to be planners and hard workers. And we like things to be organized and defined. And I remember I was sitting down with one of my mentors one time, and I was looking at him and I'm like, John, you need to tell me the steps. And he was just kind of looking back at me and he's like, it's going to be all right. And I'm like, I think I was in my third or fourth year of med school and I was doing a combined MD MBA. And I just looked at him and I was like, that is not sufficient detail. And he just kind of looked back at me, and John was like, in his 60s, and he's like, it'll be just fine. And I think that ultimately speaking, you have to have an idea of the things that motivate you and interest you and give you passion and drive, and then accept the fact that if you work hard towards those goals, you'll accomplish what you want, but you don't necessarily always know exactly where you're going to end up or where you need to end up. And the reality is that you could work very hard and be very successful and be totally not thrilled with what you're doing. Yeah. Or you could be working very little and be super successful and not be happy with what you're doing. So that element, that untangible thing that gets you excited and motivated, it can vary from person to person, right? It can be the number of clinics you have. It could be the number of patients you see. It could be the number of surgeries you do. It could be the amount of papers you write. It could be the innovation that you accomplish. But you're going to have to figure out in your career what fascinates and excites you, and always keep that as an element of what you do, because that's what's going to keep you motivated and excited and focused. And that you'll find it. And then you'll be passionate, and then you'll be successful, because passion is what drives you to work hard and focus and gets you to be successful.
And it's interesting that you actually bring that up, because one of the things I live by is the journey isn't as fun if you know exactly where you're going. That's what makes the journey interesting and more exciting for you. So I actually want to take it back. You actually mentioned mentorship. How important was mentorship in your journey, and how important is it for you to be a mentor to people now?
So I think that mentorship is extremely important. And sometimes you find it in the places where you expect, and sometimes you find it in others. And I think that the part of your journey that can become a little bit tricky is that if you go off of a traditional path, which is, say, academia or a large group practice, where you have this natural order of things, where you've got your boss and your boss's boss and your boss's boss's boss. And there are defined mentors, typically someone who's older than you, right? And you're going through a path which has been determined. I'm not saying it's easy to find mentors, but at least you have a hunch as to which direction you're supposed to look to find those mentors. But if you go on a non-traditional path, you start your own practice, you have a startup company, you're an advisor to a company and not practicing clinical medicine, you're practicing clinical medicine overseas, you're doing telehealth, you're doing something new, and you lose that traditional order of things, then all of a sudden you're like, oh, I'm doing things that other people haven't done, or I'm doing some things that physicians typically don't do. And then you need mentors as well. And finding them isn't hard. I just think it takes you to step back from your predetermined notions of what a mentor should be, and keep your eyes open and your ears open, and you'll meet those mentors. And I think that aside from my mom and dad, who are both professors, being my early childhood mentors, one of my first clinical mentors was a guy named Dr. Fernando Vinuela. So my dad passed from a subarachnoid hemorrhage when I was 22, right before I started med school. So I was at UCLA as an undergrad, and I went to UCLA for med school. And he was, tragically my dad's physician, or ironically, or serendipitously, however you want to look at it. And this guy was just, the triple threat. He was a brilliant clinician. He was a really nice guy. He was an excellent teacher. And he was either the inventor or played part in the invention of the detachable coil, onyx, which is a liquid glue. I mean, the guy is just brilliant, right? And I was always just inspired by how successful he was, yet so how humble he was, yet how good he was at surrounding himself with people that were as smart or smarter than him and enabling them to be successful. And of course, I mean, he was very kind and he guided me through some research, but I was working with like his junior, because he was a part of like this large team. But I always appreciated the grace with which he carried himself and the tenacity and the focus that he had when he was working on projects, even though he was, the highest level of full professor possible and had every accolade known to man. And the two things that stick with me were I was down in the film library, I think it was a resident, and Dr. Vinuela comes in and he asks the gentleman that's working at the film library desk for like a copy of his wife's CT scans on a CD. And he introduces himself as Fernando. And the file clerk's like, Dr. Vinuela, I know who you are. And he gives him the CD. And the other thing that always stuck with me was he always had this USB around his neck on a chain. And one day I go on, I'm like, Dr. Vinuela, what's on the USB? And he's like, I've coiled 2,500 aneurysms, plus or minus, I don't remember the exact number. And all of the images of the aneurysms I've coiled are on this. And he's like, this is my life's work and it's so important to me. And so, those were the things that motivated him. But regardless, and lots of other things, I'm sure, I mean, I didn't get that far into it, but I think carrying yourself with humility and kindness and grace goes a long way, because I think the thing that we forget is that when a patient comes to you, regardless of who they are, low or high, kind or not, they're at a vulnerable state. And that's where we're all equal, right? That's where our health is at risk. And that's the great equalizer. And I think it's important to walk away with the fact that, these are vulnerable people that need our help, and we need to be kind, because that's a large part of the healthcare experience for that person.
So you have your own business, you started your own business. What would you say is your most challenging part of starting your own business? And do you think entrepreneurship should be taught in medical school, pharmacy school, nursing school, dental school? Is that something that should be part of the curriculum?
Yeah, so I had the good fortune of doing a combined MD MBA, which I think helped tremendously. And I have friends who are like from Iranian business families, and they're just like, I mean, these guys, they sweat business sense. You know what I mean?
Wait, you have Iranian business friends?
Oh my God, are you kidding? And I have ones in medicine and real estate too. And so I think the things that come as second nature to them, as the son of an aerospace engineer and a statistician, like no one ever taught me, right? Like the measures of my parents' definition of success were like the number of papers you had published, maybe, how many different ways you could solve a calculus problem. Like no one ever talked about money. People didn't talk about business. It was just like uncouth even, right? And so those things weren't taught to me as a kid. I always had an interest in numbers and finance, etc. But like the American way of doing business, right, which is very different than the Iranian way of doing business. We have all these laws and all these legal formats, et cetera, accounting, deductions, interest, I mean, all sorts of things, right? Contracts. And so, that's just like an alphabet that you have to know no matter what you do, because money in business pervades every corner of what we do, right? I mean, if schools don't have money, teachers can't teach. If practices don't have money, they can't treat. If a church doesn't have money, a preacher can't preach. Like literally, it's that fundamental as a part of what we do. And money is just a tool, right? It's just a tool that enables you to accomplish your goal. Yeah. And so, of course, you have to understand that tool, because it can be a very powerful tool. I don't want to use the word weapon because that implies some sort of harm. But yeah, money is a very powerful tool, and you simply have to understand it. And I think the amount of business knowledge that the average physician has coming out of a standard business training and medical training is like zero. And so that 1 year that I spent in the combined program, as an incremental or as a slope to measure how much learning there was the steepest part of my training, because there was just like so much information. And then of course, people think a business education or an MBA makes you an expert in everything. It makes you an expert in nothing. It's a generalist degree, but it gives you the alphabet of business. So then you can understand things like risk. You can understand things like debt. You can understand how to read a contract, basic business law. And I think that was really helpful, because you're like, okay, cool, common sense, keep your overhead low, provide good service, be nice to your customers, both the referring physicians and the patients, be good at what you do, sell a product that's in demand, sell a product that has a margin to it, right? A profitability margin. Like, don't pick some niche that you're not going to be possibly able to sustain a profitable practice in. If your current practice model makes it impossible to be successful or profitable, change your practice model, right? I mean, again, you don't have to stay in the box. So I see physicians, oh, insurance cut the reimbursement. Now we're going to have to work 6 times harder. It's like, okay, well, no, you're going to stop doing that thing that doesn't work anymore. You're going to be like, okay, well, we have to provide this auxiliary service to then continue to offer this service, or we have to go out of network with insurance, or we have to be a non-insurance model, whatever it is for your niche. If you can simply no longer exist doing what you do the way you're doing it, you need to change the way you're doing it. And I think these are very basic constructs that no one ever teaches us, or how to negotiate a contract, right? It's the only thing in the contract that doesn't matter is your start and your finish date and the amount of money you get in between. There's all other sorts of stuff in there that could hurt you, non-competes, what the definition of you doing something wrong is, the reasons that you could leave, how long you have to stay, termination, no fault clauses, all sorts of stuff that could potentially be much more detrimental to you, tail insurance, whatever, all sorts of little nasty booby traps laying in there for you that, after a couple goes, you're like, yeah, no, I'm not signing this thing unless you get rid of that. And that's a deal breaker. I don't care how much you pay me. I don't care what my start and my finish date is. And, you have to control your work environment. I was on a Clubhouse session, and, this doctor was talking about how they have to see 60 patients a day, even via telehealth. At that point, I would be like, no, I don't think I can safely treat 60 people a day, and that's not going to happen for me. Now, I don't know, every specialty is different, but you have to feel empowered as a physician to have the tools and the resources that you need and the schedule that you need to be able to take the best care of your patients. And you don't want to go into battle without the tools that you need. Otherwise, you're going to lose every single time. And you have to feel empowered to be like, I'm going to do this, or I'm not going to do this, within reason, of course, right? You don't want to be a prima donna. And if you're not getting the things you need to succeed, then you need to step away and do your own thing, or do your thing with someone else in a setting where you're capable of being successful. And ultimately remember that you're the physician, and you've taken an oath, and you've gone to school, and it's your license, and you're responsible for that person's health, and you're where the buck stops. And if someone is asking you to do things that aren't okay, it's your responsibility to say no and create an environment for yourself where you can take the best care of your patients possible. Not every patient takes an hour or half an hour. Some patients take 5 minutes, some takes 30 minutes, and they vary. I understand that, and sometimes you can't answer everyone's questions in one session. You have to have them come for a second, but you have to take control of your environment. Otherwise, you're not going to be successful.
You said money is a tool. So would you say that you need money to get to where you want to be? And what is your thought on the statement of, money brings you happiness? Does it bring you happiness? Does it not? Because you just said money is a tool. So
yeah, I think that, from a place of, we're sitting in America, we're so fortunate, we're professionals. And my wife works on human rights issues, and she works with, refugees from the Middle East and Africa. And I mean, to say that money doesn't bring happiness is a very kind of naive statement when you're coming from where we're coming from. But money beyond a certain level, I don't think brings happiness, right? So money to give you the basic things that you need, to eliminate the fear of not being able to pay your mortgage or send your kids to school, or the basic things, that amount of money brings happiness. But once you reach a certain threshold,
Yeah.
I personally don't think, from my perspective as an individual, and I can't speak for everybody, that additional zeros bring happiness. I have people I know with many, many zeros that aren't happy, and people with enough zeros that are happy. But if what you need to be happy is the ability to conduct a certain animal, research project as a faculty member in university, you need a grant, you need money, and that research may end up leading to your success and make you happy. Or you may need another physician extender or a physician to be able to take appropriate care of your patients, or have enough people in your call pool so you don't go crazy, and that will make you happy. So again, money is a tool that gives you the things you need to be happy, satisfied. But, if you're not in the right mental space, you can't be happy. And I think that that's a function, and it's getting like way into feng shui, and like has nothing to do with medicine, but it has to do with understanding yourself as an individual and kind of accepting the things you can't change, understanding the things you can change, and working towards a happiness, and that's, I know it's getting vague, but yeah, money is a tool, and it doesn't make you happy beyond a certain point, but it can give you things that can enable you to be happier.
Yeah.
So to bring it back for our viewers that may not know, can you just talk a little bit in detail about your practice and what sets you apart from other practices?
Oh, sure. So I jokingly call myself a human plumber, which makes my mother cringe, because she's like, what you do is so complicated, and you don't want to belittle it. And it's not to belittle it by any intent. I think that when patients come to see you for a medical condition, they have anxiety. And the intent of that is, one, just to simply help them understand, and two, is to make them laugh, to diffuse the situation. And I feel like the field of interventional radiology, is one of the most amazing fields. Of course, I'm biased, but I really do believe that, because I think that, we do things that other people simply can't do, or we do them in a more slick way. I kind of like to think of us as the MacGyvers of medicine, right? And that's kind of how it started. There was a guy named Dr. Daughter in Oregon, and he was given a patient with a blocked or occluded artery in his thigh, a superficial femoral artery, that wasn't a candidate for surgery. And through a small puncture or hole in the common femoral artery, he put a metal dilator, right? So a small metal cannula with a bulbous tip, and he put it through the occlusion, and he opened it up. And if I got the details of that wrong historically, I apologize to my fellow interventional radiology historian. But he basically started that concept of, surgery without a scalpel. And of course, the field has burgeoned, and it's gone into all sorts of things like the treatment of cancer, the treatment of gynecological and urological conditions, varicose veins, peripheral arterial disease, aneurysms, strokes. It's all over the place, and it's huge, and it's super successful. But it's also challenging in the sense that it's a new field. And the way we think about medicine is body parts, right? You're the brain surgeon, you're the brain doctor, you're the neurologist, you're the brain doctor, you're the cardiologist, you're the heart doctor. And we're not necessarily bounded by the traditional geography and borders of medicine. We are treating different conditions and different pathophysiologies in different parts of the body. And so when you explain that to patients, they might be thrown off by the fact that, like, I treat uterine fibroids, I treat visceral aneurysms, I treat occluded arteries outside of the heart and the brain, I treat varicose and spider veins, and some of them are life and death, and some of them are cosmetic. It's a full range, right? And patients will be like, oh, okay, you're an expert in all these things. Or the word interventional radiology, like, what does it mean, right? I remember before I got married, like, I would go on dates and people are like, what do you do? And I'm like, I'm an interventional radiologist. They're like, oh, so you read films? I'm like, no. And they're like, oh, you do surgeries? I'm like, yeah. They're like, oh, you assist the surgeon to do surgeries? I'm like, no, I do the surgeries. And they're like, oh, so why do you say you're a radiologist? So the name can also be a little confusing. But I think that if you step away from those things and you just present yourself as a specialist in whatever it is that you do, I just say I'm a vascular specialist because I treat a lot of vascular conditions, spider veins, varicose veins, clogged arteries, aneurysms. And I then communicate with the referring physician or the patient, and I make it easy for them to get an appointment, to get information about their insurance, to figure out how much they're going to have to pay out of pocket, to make their records available to them, to make them available to their physician, to do our procedures with a high level of expertise and good outcomes because we focused on a few problems and become experts in them, offer outpatient procedures with faster recovery, a lower pain, better outcomes, less downtime. And, just be kind and humble to your referring physicians and your patients, and present yourself as an expert, but someone to help, rather than someone who's condescending and coming from a place of, I know more than you, and, you should know. I mean, why should they know? I know nothing about some micro subspecialties. And I simply just go to them. I'm like, hey, I have this patient with this problem. Can you fix it? And I present myself as the same for my referring physicians, right? I go, you have a problem for your patient. I'm going to make your patient feel better. And I'll make sure they get back to you so you can make them feel better. And when I have someone that needs their help, I send it back so we can take care of them as a community of physicians. And I think that, as basic as it sounds, if you're able to offer those elements, you will succeed in your niche, because there are so many large and small practices, renowned and unknown practices, that fail to offer every element of that in every category. And also remember to be kind to your patients, to spend time with them, to be accessible to them. Because it doesn't matter how great you are, if you are not providing good service to your patients, if they walk away feeling that they haven't gotten good care, that they haven't gotten their questions answered, that referring physician doesn't know what you're doing, and you're doing great work in a box, but you're being not so kind and cooperative with your colleagues, no one's going to know it and appreciate it, right? Because nobody knows what you do underneath the surface. And one of my plastic surgery mentors was like, yeah, the only thing the patient sees is the incision and the stitches. If you're working on the inside, maybe on the face, they see the facelift or the nose job. But you have to make sure that you present the portion of the work that you're doing as in good a light as the critical things that you're doing that they're not going to see, right? And you want it all to be good. I don't know if that answered your question, but I hope it did.
As a practicing physician, do you think the way you're looking at yourself as a physician, that personalized treatment plans for each patient has been something you've spoken on and previously, and that's what something you live by? Do you think that that's missing in current physicians, or even you coming up students right now in medical school? Do you think that's missing? I think you're very humble physician. You care about the patients. You work collaborating with other physicians to make sure the patient is getting the best treatment possible. Do you think that's kind of like missing? Some people maybe coming in for the money, going back to that, or coming in for the wrong reasons and not really for the reasons you're speaking of?
I'm going to speak to it via numbers, which I think my mom would be happy because she's a statistician, right?
Okay.
I think that people sometimes try to villainize any group of individuals. It could be pharmacists, it could be doctors, it could be radiologists, it could be a surgeon, it could be an attorneys. And then you have to say, okay, we're going to stop and we're going to look at these individuals as a group of people, right? Let's say there's 1 million attorneys. I'm sure there's more. And then you have to look at the percentage of them that are behaving undesirably, and how undesirably are they behaving. And then you have to ask yourself, how many of those people are behaving that way because they're intrinsically that way? How many of them are behaving that way because of their environment? So I think as physicians, as a group, I think for the most part, we're pretty altruistic, right? Because it takes a really long time to become a doctor, and it's quite expensive. So if you wanted to cause a harm, there's a lot of easier and quicker and simpler ways to do it, right? And if you wanted to be dishonest in business, there are a lot of easier and faster ways to do it. So then the question becomes, are there a few bad apples in a very large, crop of, apples and apple trees, etc.? Sure. And then there are those physicians, I think, that it's not that they're not genuinely interested in providing really good care. It's that they're in an environment. Remember, we talked about money and tools, where they're tired, they're burnt out, they don't have the resources that they need, they don't get the insurance payments that they need. They're in an underserved community where everyone's just really sick and can't be possibly cared for by one person. They need a team. And so there's burnout. And I think that you can provide excellent care, but it either means that you, under good fortune and fortuitousness, fell into a system that allowed you to do that, or you took the time with hard work and painstaking, scratching it out of the walls, creating a system for yourself where you can do that. And I think that, I'm early in my career, but thus far, to some degree, I've been able to kind of create a little bubble for myself where I'm able to, for various reasons, care for my patients in a way that I think is appropriate, right? Their insurance changes and they simply can't see me for a follow-up. And I've done the procedure where, I can't do the procedure for free because it's expenses, disposables, anesthesia, time. And I can't simply pay for it out of pocket. I'll go broke, but I can see them for a follow-up, no charge. Or I can do a follow-up ultrasound, no charge, because I've already started their care. Or maybe I can do a quick eval and say, okay, this is who you need to go see, go get plugged into whatever system you're in. And not do it all the time, but do it selectively because that's a person that needs your assistance. Or spend 45 minutes with a confused young patient with a left lower extremity that's swollen because they have May-Thurner syndrome. And what the heck does that even mean, what I just said, right? Or, taking a phone call or texting somebody back with a question and saying, HIPAA compliantly, and hi, I got your message, I'll call you back, and discussing it. But things like that, I've been sick, we've all been sick, and we've gone and seen that expert, and then we walked away and, we're healthcare people, right? We're experts, and left confused and been like, oh, shoot, like, I forgot to ask that question, and it bothers you and it hangs over your mind. Well, if you can get that guy on the phone and, in 2 minutes of his time, he's like, yeah, sure, Ali, don't even worry about that. That's a non-relevant issue. It's just in your head. And all of a sudden, your day, your week, your year, whatever has changed, and making yourself accessible. So I think that, most doctors care. They just haven't been given the tools and the resources to implement their altruism.
Like you said, you're early in your stage and practicing. You're young. Do you think that I guess the honeymoon stage is what's caused, making you be the physician you are now? And what are you doing to not get to that level? Like as you get older, as you get more inside the practice, you're practicing more often, to not get to that burnout. Are you setting things in place so you don't become that person?
Sure. So, it's not one size fits all, right? Ali's answer is not going to be Nima or Aaron's answer, right? Every person's answer is different. But when we talked about engagement and doing what you're passionate about, I love clinical medicine. I love seeing patients. I love doing procedures, and I get my energy from people. I'm a people person. But, I do a few procedures at a very high frequency, and I consider myself very good at those particular things I do. And some of them I've done coming up on 10,000 times. The others easily thousands of times. And a case is a case, right? And even the most complicated cases, after a while, except for a few rare outliers, it's another case.
Yeah.
But there's a person attached to that case. And helping that person is fulfilling and wonderful. But even that can become routine if you're the kind of person that wants to innovate or expand your business. So you have to find the things that interest you and focus a part of your time to them. And then remember that the rest of what you're doing, you're really helping people and you're really making a difference in their life. And then I think that, if you're a pure clinician and you just get your energy from it and you're going to keep doing those procedures for the rest of your life, that's wonderful. But if you're the kind of person that's like, okay, this is getting a little repetitive, then you can take part of your time and dedicate it to business development, giving talks, working with industry, innovating devices, doing clinical research, but just mixing it up. And that might change over the course of your however long career you want to have, right? It might be a decade, it might be 50 years. That's up to you. And keeping yourself motivated and remembering, the words of my mentor, John, and saying, well, yeah, I don't know what's going to get me excited in 20 years. It might change, and constantly pushing the envelope and finding that thing that gets you passionate, because then it'll keep you excited about the rest of the stuff you do. Yeah. And I'm pretty sure that even if I were to accomplish all of my non-clinical goals, I would still want to practice forever, because just because I don't want to do, 2,000 cases a year doesn't mean I don't want to do 500 or 600 or 700, because it's, you love it and it's still your passion to help people, but you're like, okay, I've done this a lot, I want to mix it up a little bit. But you would miss it if you stopped doing it completely,
Yeah.
So this pandemic has affected everybody and nobody's exempt from that. So how has COVID affected your business and how have you had to adapt to it?
Yeah, so I think that for various reasons, me and some of my other physician cohorts made the move to outpatient practice and a tele-enabled practice years ago. and serendipitously happened to be the beneficiaries of this change, right? Because I mean, some of the things I do are cosmetic, right? Spider veins, facial veins, whatever. I mean, those things, you know, they don't need to be done during COVID, and they shouldn't be. But then I also do some wound care stuff and limb salvage stuff and amputation prevention stuff, which clearly, you know, I mean, if someone's got a dead foot, you can't tell them, oh, okay, you know, come back in 2022 and get an amputation, right? We got to keep doing it. And, you know, when the hospitals got jammed up with COVID, we were still able to continue operations safely, of course, with, you know, appropriate case criteria and, you know, abiding by state guidelines with what was okay and what wasn't okay at the given time. And then using telehealth, you know, makes you more accessible to a wider geography, makes you accessible to someone who may be disabled or handicapped or mobility limited, except for, you know, coming for their procedure or the very specific follow-up. And I think we happen to be fortunate that we were positioned in a way where we had those tools in place and we practiced in a niche that was critical and, you know, just couldn't simply wait. And I guess, you know, sometimes I remember I used to do a lot of dialysis work on renal failure patients, and I would come home and I would just be like, oh, these patients are so sick. And, you know, it can wear on you emotionally. And then I remember, I think at one point, I don't remember if it was my mom or my aunt or my wife, but she was like, you know, I mean, it's good, right? You're helping people that really, really need your help and are really sick, and it's not elective. And, you know, I mean, the advantage of working on people who are critically ill, other than being able to obviously help them, you know, sustain their life and their health, is that you need to continue doing what you're doing at all times, but setting it up in a way where you can have control and provide good service and not be kind of subjected to the whims of a system that, not that there's anything wrong with the system, but that, you know, there's 1,000 levers that you can't pull or stop pulling to enable you to accomplish the goals you need to accomplish, then that's a problem, right? If you want to have a successful business, there's no way that you can vertically and horizontally integrate everything, but you need to identify the portions that you can control so that when things get a little kooky, you can still continue to provide good service, right? Like if you have some critical supply in your supply chain, if you run out of it, you've got a problem and it's not super expensive, well, keep a bunch of it. So when there's a shortage somewhere because of a hurricane or an earthquake or a fire, you don't have to stop service because you ran out of Lido with Epi or whatever the heck it is, you know? Like just anticipating these things, or having a procedural suite in your office so you can do procedures in your office in case, I don't know, the hospital gets jammed up with COVID or they have to cancel your cases because there's a shortage of staff, whatever, you know? And I mean, I'm not saying that everybody can have a procedural suite or everybody can do all their surgeries in the hospital. I mean, outside of the hospital, you know, some things have to be done in the hospital, but controlling the elements that you can control so that you can continue to provide good service when something in the night goes bump.
When you did a fellowship at Johns Hopkins, what would you say is something that you learned during that time at Johns Hopkins that you possibly couldn't have learned anywhere else?
You know, I got tremendous training the entire way through, and I had really good mentors, and I was really fortunate. One thing that struck me as, you know, really special about Hopkins, there was a few things. One, obviously, amazing, world-renowned, you know, clinical and research institution with a very high level of excellent physicians. Not to say that UCLA didn't offer the same. Hopkins was a really big hospital with a lot of pathology. And I think that when Mr. Hopkins funded the founding of Johns Hopkins, he did it with the intent of it being a hospital to serve the underserved of Hopkins. And then it turned into this renowned, enormous institution with, you know, the needy and the not so needy from the vicinity, people coming from all over the country, and then people coming from all over the world, right? We had large donations from the UAE and Qatar, so the royal families would come, citizens of those countries would come, they had wings, etc. So literally everybody under the sun was there to get treated. But the original ethos of Mr. Hopkins pervaded through Hopkins, which was that this is a place where residents come to learn, and it's a resident and fellow driven institution. And that never changed, even though it went from an inner city hospital to a world-renowned academic center. And in every corner that I went, you saw really, you know, the fellows and the residents doing a lot. We had a lot of cases, and we had a lot of really complicated cases. And we were pretty much first performer on those cases. Sometimes, the attending would be available in their office. Sometimes they'd be watching from the view room. Sometimes they'd be scrubbed with you. But we got to do a lot of cases, and we, the fellows, got to do the cases. And I think that when you're a proceduralist, whatever your procedural niche may be, it could be cardiac surgery, it could be interventional radiology, you have to do to learn. You can't learn by watching. And I think that even though it was a short course of training, it was a year, I mean, we got benevolently thrown under the bus and came out of the other end technically super competent and clinically competent and confident to know that we had caused complications, which were appropriate complications within the realm of what we were doing, that we were then able to fix. And so when something went wrong in a procedure, you're like, oh, well, that's happened before, maybe in an extrapolation, but still it's happened. It's going to be fine. I'm going to fix it. And you move forward with your case and you maintain your calm and your stature. You don't panic. You don't get angry. And procedures end well when you maintain your calm and your stature.
So I know we're moving from more treatment-based medicine to more preventative medicine. Preventive medicine is basically the wave of the future. So what do you think is the future of medicine, and how do you plan on being at the forefront of it?
Sure. So, I mean, I can't think of a specialty that's more about better, faster, cheaper, less invasive than interventional radiology, right? On the treatment side. Now we're talking about prevention. And I think that prevention comes from the person, right? Like the doctor cannot prevent you from doing things that are poor decisions. I mean, there's no one that can prevent you from doing it other than yourself. And I think as a society, we have to decide if we want to start making healthier choices for ourselves, right? And we talk about the standard American diet. It's actually the standard American lifestyle, right? It's a lack of movement. It's a lack of sleep. It's an excessive stress. It's an over-consumerism, needing to have stuff. Like, why does anyone need 100 t-shirts? You have one body. You don't need 100 t-shirts. You might need 10. And all other sorts of stuff that we consume that then is expensive, that then we need to like work harder to make more money, to buy more stuff. And then there's the food that we eat. And I mean, it's just amazing how much calorie-rich, nutrition-poor food you can find out there. And it's almost like, I mean, God was brilliant, right? He made this amazing human form that was almost impossible to foil. And then along comes, the fast foods of the world with 2,000 calories in a small brown paper bag that has 0 nutrients. And all of a sudden, you can have someone put on 50 pounds in a couple of months. And you're like, holy smokes, how the hell did that happen? Now I challenge you to try to gain weight eating cucumbers. My Lord, you will have some GI issues.
But it doesn't taste the same. It doesn't taste the same.
And you know what's interesting? The fast food doesn't taste good.
It really doesn't.
Get an organic apple and bite into that bad boy, and you'll be like, oh my God, the flavors in this thing. It is amazing because
I don't know. Chick-fil-A smell. Chick-fil-A
I know exactly. Right. You keep eating that Chick-fil-A, I guess you're going to keep me busy forever. I'm not worried about those clogged doors. I mean, yeah, at the beginning of the pandemic, I'm like, will I be busy in the future? And I'm driving along and there's a 1-hour line in the Chick-fil-A drive-thru.
Yeah, you're going to have some business.
Yeah. And I'm like, I'm going to be busy. Sadly so, right? But I mean, so it isn't like, yeah, people talk about e-health. How you handle the data doesn't change the data. 2 + 2 = 4, no matter whether you count, do it in your head, use an abacus, a supercomputer, or a calculator. And if your 2 + 2 is nutritionally poor food and no activity, you're doomed. And I don't care what anybody says.
Now, I think it's easy to say that, but you have to understand that obviously the cost of living is extremely high. Underserved communities, they don't have access to these things.
And a banana costs 50 cents.
Yeah, I'm just saying, like, if you have a family.
I've had this conversation with my wife so many times, and I understand she works with underserved communities. But walking is free, and a banana is cheap. So
I agree, but you have to also understand that when you have maybe a family of 4, you already have a job that doesn't pay much. You're trying to make sure everybody in your house is healthy.
Give them free healthy food. Give them free.
We're in a position where, let's be real, we're a little bit more privileged than the average American where
Absolutely.
we're at. So I think what needs to happen, what institution or things needs to be put in place so that these people can have access to all that stuff. It's easy. In other countries, they don't have that problem. It seems to be an American thing. So what can we do?
Well, I don't think we uniquely have the problem of we have a lot of resources and we have
but it's all at the top.
and it needs to be redistributed to some degree. And I'm not disagreeing with you whatsoever, but literally I was saying that if someone can't afford healthy food, we should give them free healthy food. Because it is easier to give them free healthy food than letting them turn 65 and getting them free unhealthy care.
Exactly.
I think that education should be free. One, because I'm a nice guy and I try to be benevolent. But number two, if I educate you and you get a job and you pay taxes, I will make money off of you because you now have a job. If I house you, if you're homeless and you're really homeless and you really need housing and you simply can't afford it and you're being ridiculous, or you have a drug addiction, in which case you need care for your drug addiction, it's cheaper than letting you run amok and going to the ER and having drug overdoses and alcohol overdoses and getting treated. It's cheaper to do the right thing. So it makes sense from a numbers perspective, and it also makes sense from a humanitarian perspective. And we have to remember that money is a tool, and it makes sense to do the right thing with that tool, especially when it makes sense for the numbers and it's the benevolent thing to do. Right now, it's in a fortunate position where the two line up. It gets tricky when the right thing is not the cheaper thing, it's the expensive thing. When we should still do it, but we have to be selective. Whereas then you come up with like some exotic designer treatment for some rare disease that's super expensive. And then you have to make that tough decision of, is the incremental benefit to society worth the cost? Or do we have a place where we want to put these dollars, like inoculating children with vaccines or feeding inner city people or educating them? But that being said, there are still situations where people have access to healthy food and activity, and they still choose inactivity and unhealthy food despite access, and the standard American lifestyle definitely throws them under the bus. And that is where the individual responsibility comes in. And as a society, we need to start taking more ownership and be more individually responsible, because you can put healthy food in front of someone, but if they're not going to eat it, it's not going to make a damn difference. So we have to enable people by giving them affordable jobs, by giving them affordable housing, by giving them good jobs. I mean, our minimum wages are ridiculous. They're insulting, right? People do need a living wage, and there's no two ways about it. But you know what that means? That means that your cheeseburger is going to cost twice as much, which means you get to eat less cheeseburgers and you have to cook for yourself at home. Your t-shirts are going to cost more, so you have to buy less t-shirts. And you shrug your shoulders because you're a decent dude and you don't care. But some people want cheap t-shirts and they want cheap cheeseburgers. And they have to accept the fact that if we're going to live in an equitable society, stuff is going to cost more, right? Like you go to Sweden, taxi cab driver's happy because he gets paid a living wage, but the taxi is way expensive because it reflects the true cost of his labor. And so stuff's got to cost more. We got to buy less stuff, and we need to be more personally responsible. I'm not coming from a place of privilege and saying that, you know, it isn't our responsibility, but it's our responsibility as a society to provide those tools. But then it's those individuals' responsibilities to be responsible and use those tools. On both sides of the equation. I honestly believe that.
Would you say it's easier to eat unhealthy?
It is a lot harder to eat unhealthy, but it's more convenient to eat unhealthy because there are unhealthy options all around us, and we need to address that issue. But I mean, I remember I was a fellow and I was getting crushed and so busy at work. I was by no means affluent at the time, right? Didn't pay as much at Hopkins. I just go to the grocery store and I'd buy a bunch of fruit and I'd put it in my bag for the week, right? Like, I mean, I know I didn't have 4 kids. And
Well, that's what I'm saying. Like fast food, all you got to do is drive through. Groceries, you got to park the car, get out the car, go inside, purchase, bring it home. It's just easier.
And then you also
unhealthy.
have to understand that like you keep talking about access. Access is great, but access to these healthy options are not in these inner cities.
They're not
in the more affluent
city
communities. And the whole, like, let's say Whole Foods, that's way more expensive than everything else.
True.
Now, I would love if there was like other alternatives, but like it sounds good in theory, but until you're on the road really seeing how that, it's not really like that. My mom's a social worker. She's been for 30 years, so like I have a little bit more insight than the average person. And what you're saying sounds amazing, but practicality, I got to be honest, is not there. So, and when the lobbyists at the top are the ones making the money, making those deals, of course it's not going to happen because like they're making the money. So I think there needs to be more of a practical approach. Now, it is not obviously profitable to invest in the lower socioeconomic status as well. And that is the issue. But I feel like that's more of an American thing versus a grassroots effort. I don't know. How do you feel?
I think that you're 100% correct. I will sometimes have clinic in an underserved area and try to keep a really clean diet, and I'll be like, oh my God, it is impossible for me to find something that meets, my choices, right? And I bring it with me from wherever the heck I'm coming from, and I have access to it easily. And it's not cheap, but still cheaper than a prescription of Xarelto, which, costs $20 billion a year to our system collectively. And man, being overweight, having diabetes, those are really expensive choices for us collectively. And so it's super easy to go to a reasonably accessible, reasonably priced grocery store and buy a bunch of fruit. But you're right, sometimes it's hard to find and you don't have the time to drive 30 minutes. So you're 100% correct on everything you said, but we have to change that. And it doesn't matter who's lobbying for what and how much money they make. It's costing us more on the back end, right? We're letting these people put in these rules so they can make $1, but on the back end, it's costing us $100 because everyone's overweight and everyone's unhealthy. And it's not sustainable. So it's a problem that has to be fixed. It's not a problem. I mean, if it doesn't get fixed, it will sink the American ship, because the cost in terms of human life and healthcare dollars will balloon and it'll just be unsustainable. So we have to make healthy, nutritious food available to everybody at a reasonable price, in whatever form that needs to take, whether it's delivery, whether it's assistance, whether it's, making stores, putting stores, subsidizing stores. I mean, healthy, good food has to be available to everybody. But that being said, there are still affluent Americans who have access to everything under the sun. They still make really poor choices.
Exactly. I was just about to say that. Like, let's just even talk about the people that have access to it. It's easier to go buy a DiGiorno, pop it in the oven, than go do your grocery shopping and try to make a healthy meal. It just takes longer. So you're just,
or go to your bougie coffee shop in my neighborhood and get a chocolate croissant. I mean, the point is that I refuse to budge from my position that as Americans, we are very entitled about certain things. And we have to take ownership of the part of the problem that we are the cause of. Otherwise, it won't get fixed. Because again, tools, you have to pick them up. And if you don't pick them up, they don't work. So we have to put those tools in place, but we also have to then take advantage of those tools, because we are tremendously privileged, even as the most unprivileged Americans, because we have freedom. Most of us have a roof, we have water, we have sanitation, we have some access to healthcare, whatever form it's in. And I remember I did volunteer work in Mexico, and I mean, people would ride the bus for 14 hours to come see us. And I mean, in America, no matter how busted you are, you can go to the hospital and get care in an hour or two. So we're still more privileged than a lot of other people. And we can fix those problems, but we still have to appreciate how privileged we are and take advantage of the tools, but then also help those people that are not getting the part of the privilege that they deserve by putting just decent, common sense humanitarian stuff in place, like reasonable jobs, reasonable housing, safety, access to education. I mean, our schools are embarrassing, right? You go to a school and you're like, this public school looks like it belongs in a third world country, and the books are from 30 years ago. And that's what we're not spending our money on, is education. I mean, if we educate our kids, then they'll be smart, and they'll get jobs, and they'll pay taxes, right? So that's a huge problem. I'm not saying you're wrong, but we also have to take responsibility to some degree. It's definitely on both sides. And you're right, it's impossible to succeed if you're not given those tools. And, we have to give more funding to our schools. We have to give more funding to our at-risk healthcare institutions, and we have to make healthy food available to people. But we should probably also make unhealthy food super expensive.
I think that's what it is. Because if the people that have access to it just choose to be unhealthy, I mean, what are you gonna do with when the person that doesn't have access? You can't expect that from the person that's doesn't have access to it. Like, the people that have access to it are already choosing to be unhealthy. Now you just want the people that don't have access to it to also be to be healthy. It's just
like cigarettes. Tax the hell out of sugar. Put the money in some system that pays.
Look at Starbucks. If you look at the line of Starbucks every morning at 7 a.m., you know how much sugar there's in it?
You thinking they're giving away food over there?
Yeah, man, make them sell bananas cheap.
Yeah.
Well,
the funny part about that is every time you walk into a Starbucks, I don't know if you notice, there is a basket of bananas and apples on the side, but you never see anyone pick that up. I don't know if you noticed that. Pay attention next time you go in.
It is a $2 banana. I admit that's expensive, but it's still a healthier and a cheaper choice than the $5 muffin.
Yeah.
And there's nothing wrong with a weekly muffin, but it can't be a daily muffin, right? I mean, I myself, over the pandemic, like, I gained a couple pounds and I'm like, oh shoot, and I lost it and I got more active. And I looked and I'm like, I have a healthy diet. They started writing it down. I'm like, no, I don't. Like, no, I don't. And that's the thing. So you're 100% right, Aaron. I mean, our system is so asymmetric and so unfair, and that needs to be fixed. But again, we have to take our own responsibility too. You're totally right.
Now, because I love talking about this stuff. So now the next step is, okay, I think we can all agree that education will change everything. That's great. But the cost of education is astronomical. So now how do we get to that step? It's just at every step, the people who make the decisions, they understand that we all know keeping people uneducated is the greatest way to control them. That we all know that. So now, okay, we need to educate them about healthy choices, how to get jobs so then they can pay taxes. But we can't do that. We all know student loans have the highest interest rate out of any loans you can get. So what do you think we can do as somebody that maybe not have a political influence? What can we do? Like myself and Nima, we give a lot of webinars and mentorship, and like that's kind of our service to the community. Like what do you think as a nation that we can do to, even though maybe the political side isn't going to help us, what can we do to still make a difference anyway?
Now you're dragging me from stuff I'm an expert in, like IR and sort of
that's
the stuff I don't know anything about. I'm going to have to think about this, but I've thought about this a fair bit and I have my opinions. I mean, one, obviously vote. Two, contribute, both in terms of money, in terms of airtime, both in terms of personal and public airtime. So when you're with a group of individuals, if they say something that's intrinsically unfair, racist, bigoted, speak out and call them out on it and make them aware that what they're saying is ridiculous. And most people aren't intrinsically evil. They're just ignorant and they just don't know better. And they're afraid of the unknown. And they'll get better over time. Their views will become more reasonable because they're humans and they care. And most humans aren't born with some evil gene, you know what I mean? They just are afraid of the unknown. And also, I mean, education is expensive and it's not, right? JC isn't expensive. Harvard is expensive. And not everybody has to go to Harvard. Harvard, for whatever reason, is the price it is because they've chosen for it to be that way. But getting people good public education at a grade school level, that should be obviously the job of the government, right? Safety, roads, education, incarceration. These shouldn't be for-profit privatized things. These are public goods. And then beyond that, I mean, hopefully with e-education, people can self-educate. People can go to e-universities. They can go to online universities. They can attain that knowledge. And I think the way the world looked when I was a kid was that if you wanted to be successful, you had to go to one of the gatekeepers, right? You had to go to a good university and you had to get a fancy degree. Now you see super successful people coming out of left field, super random, whether it's YouTube or Instagram or a million other things I don't understand, cryptocurrency, startup guys that haven't gone to a formal education. So I think that e-technology is sort of leveling that field and enfranchising the previously disenfranchised. But beyond that, I mean, I haven't sat down with like a group of experts to come up to a solution to the problem, but I think that we have to pay for those basic goods. But the thing is, right now, corporations pay very low taxes. Some people pay no taxes. Some people pay very high taxes. Some of those people that pay low taxes don't make money. Some people that pay low taxes make lots of money. And then the people that are paying really high taxes consistently are professionals that earn their living. But if you were to take all the money that we spent and all the money that we make, okay, we made $1 trillion. Obviously, we made more. And we spent 300 billion, but I'm just making up a number. That's 30%. And if you were to apply a global tax rate to everybody, corporations, individuals, income earners, whatever, any form of income, capital gains, everybody got taxed the flat tax after the first 50 grand they made, because below 50 grand, you just get to keep your money because you need that money to survive. I think that you would see a more equitable tax system and you'd see the ability to spend that money where it's needed. And then we waste a lot of money. We waste money in all sorts of places that it doesn't need to be spent. And we also spend money in places that it does need to be spent. So I think we then have to sit down and make hard choices and be like, okay, well, this special needs project, is getting a lot of money. It's not making a lot of benefit. We're going to cut this spending, right? I mean, in California, good Lord, taxes never go down and no one ever cuts spending. And I'm like, you can't just keep spending more money, because at one point, the amount of money you're spending is going to be more than the amount of money you make, and they're going to be negative. And our deficit's insane. Like, you can't continue to negative deficit spend. That's just like a grade schooler can tell you that, right?
Yeah.
And it's like, well, no, now the Nobel laureates are telling us that we can perpetually spend more than we make. And I'm like, no, that just doesn't make sense, right? Like, common sense is always right. It might not be right for a given period of time, but that just means because we're ignoring it. And so, yeah, we'll have to make some tough choices and not spend in certain places and spend in other places. We don't have the ability to spend infinite amounts of money on every little thing, but collectively we can decide what things matter, and we can spend that money on the things that we think matter most. And some people will be upset, but it's okay for X percentage to be upset. That's democracy. Not everyone's always happy, but sometimes one guy is happy, sometimes the other guy's happy. And it changes from person to person and time to time. And under normal circumstances, when the two parties function normally, which is not what we've had recently, it balances out. It goes back and forth and it kind of zigzags. But that's nature. That's the beauty of nature. That's entropy, right? And then sometimes it goes kooky. But then fortunately, the system kind of spit out that faulty bug, and hopefully now we're working back in the right direction, right? But the system survived that faulty bug, like our body survives a funky virus, and we're moving in the right direction. And it's the only messy system that works, right? I mean, the idea of a benevolent dictator is nonsense, right? I mean, one person with absolute power always loses scope of what's good for the collective, because they lose communication with the collective. Yeah. And so this is the best we have. We're gonna have to deal with it.
So I was on your Instagram page, and we won't talk about your Tom Brady post. So we'll just go past that one and go to the other stuff.
I'm not even a big football fan. That's my manager, but like, man, the guy is a machine. I mean, me and my buddies were betting, and I don't know diddly squat about football, but I was like, I'm betting with Brady because he never loses, and I won. And they're like, well, you don't know about this, the Chiefs and that, and this and that. I'm like, yeah, Brady never loses. I mean, the dude is he's amazing. Yeah. Not a huge football fan, but yeah.
Me neither. So you post a lot of quotes on your Instagram page, and a recent quote you posted said, "The whole problem with the world is that fools and fanatics are always so certain of themselves, and wiser people so full of doubts."
So true. I love that quote. I put up.
I could tell. What suggestion do you have for the wise person that has doubts in 2021?
Put your doubts aside. If you are that intelligent, insightful, considerate, thoughtful person, you have probably done so much internal calculation and weighing and analysis and consideration of the opposite side that by the time you're ready to speak, the chances that you're going to say something reasonable and kind and humble and considerate are high. And we work on probabilities, right? Not certainties. The only things that are certain are history, and it's too late after the fact, right? And it's like that uncertainty principle. Was the Heisenberg uncertainty principle? Like, you can't know where something is and where it's going exactly in time and space. Like, you can only know a little bit of each. And the more you know about one, the less you know about the other. Speak up, speak your mind, and speak with the fact that, maybe you're wrong. Like, I think that when I was talking about personal responsibility, Aaron, I was partially wrong, because I probably came from a place where I didn't understand the difficulty with which it has access to healthy food and education and healthcare in a place where you're coming from a community that's underserved, right? And I apologize. And so I have the ability to say things out loud and then realize when I sound like a jerk, and then reassess my statement. And I'm kind of a hard ass, I think, because I've always, like, we came here as immigrants, and my parents were very comfortable in Iran, and then they came here with nothing, and they had to build back up. And then, my dad passed, and I had to be tough and just get through it. But it's like a nice hard ass that can admit when he's wrong and recalibrate. And that's the same thing with, like, when you're speaking the truth, right? It's like you're speaking your truth, and then you realize that it's wrong, and then you can apologize and readjust. But if you don't say anything, the fools and the selfish will continue to speak. So speak up and speak from a place of intellect and a place of emotion, but not a place of anger, and create a dialogue and see where it goes. And I think that, you know, if you look at any politician or statesman, if they're well-intended, at some point they'll find a soundbite where you said something inappropriate or something stupid, but that's a snippet. But when you look at the person and their intentions collectively, you're like, okay, this is an evil dude, or this is a good person. And if you hurt some people along the way, it is what it is. You know, I mean, if you hurt some people's feelings along the way, it is what it is. You can't always make everybody happy, but you know, as long as you're not causing them physical harm and you're trying to help the collective with whatever it is that you're saying, I mean, that is the common, you know, that's the modern world, and that's the conversation that happens. So just speak up, push for what you know is right. And, you know, like there's certain things we just know are right, right? Like freedom of choice, freedom of religion, being able to choose our representatives, have them leave when they lose, have the new guy come. And like, I don't know, maybe you stand on one side of immigration and your friend stands on the other side, or whatever that topic is. But as long as it's on an intrinsically evil and bigoted position, which most people don't have, and if they do hold it, it's because of a misunderstanding or fear, and they can be educated out of it. You don't have to demonize the other side just because you disagree on one topic, right? There's that other 99 topics that you agree on. Find the common ground, speak to one another, and voice your opinion, because there are a lot of fools and there are a lot of selfish people. And sadly, they're usually the ones talking. And you need to be like, no, you need to be quiet, go away, and let us people that are actually taking the time to educate ourselves and are interested in the social collective and good get to work and do what's necessary here, right? And you're right. I mean, we're in such a wonderful place, but like our country's kind of lost its direction a little bit, in the sense that, you know, we do need to take better care of education, healthcare, equitable access to food, and just speaking with one another with decency and respect and kindness, letting scientists speak when it's about science, right? I mean, I don't know, I'm in Clubhouse sometimes, we're talking about stuff and this topic comes up and I don't know anything. And someone asks me and I'm like, I know nothing. Like, what the heck do I know? You know, be humble and just say you don't know it and let the person who knows speak.
Exactly.
Being quiet is a good tool.
Yep.
But not when you have something good to say. And
So I want to end it on a fun question. Now, if we were to go back to undergrad or high school and we were to talk to your best buddy or your professors and we'd be like, hey, who was Ali? What would they say?
Ali. You know, Ali's changed a fair bit over the decades. I was always social. I'd like to think I was always kind. I was a big freaking nerd in high school and college, and I owned it. You know, I was just like really brainy, and I was very focused on school, and I just loved knowledge, and I wanted to have as much of it as possible. And I was pretty damn competitive, probably a little too competitive. Never like with the intent of making anyone else look bad, but just like being the best I could be. And I think that what happened was when my dad passed, I realized that like being competitive is good and being self-driven and motivated is good, but you also kind of have to have fun along the way. There isn't like this magical place that you're going to that when you get there, it's like, ta-da.
Yeah.
And there aren't a number of zeros or surgeries or degrees that are going to like make you feel fulfilled. So just like try to live that balance of being a good person, a decent person, a very internally driven and successful person. Just get rid of the word competitive, right? Because it implies external comparison, which is, you know, who cares?
Yeah.
But just have a good time along the way, whether that means, you know, going on a crazy trip with your friends and having a wild time, or going on a bike ride up the California coast, whatever that means to you. You know, we all express ourselves and enjoy ourselves in different ways, but just have some fun. You know, you're both in your third year of pharmacy school, so you're somewhere in your 20s or maybe older, in which case I apologize. But,
I'm older. It's okay though.
Making assumptions.
We look good. We look good.
You look good. There you go. And you've got a lot of life left. And I think that we make this very not intelligent assumption that like we have to accomplish all of our goals by a certain age.
Yeah.
And that like life ends after 40 or 50 or 60 or 70 or whatever it is. And you have to stop working at a certain age. And
yeah.
And that's nonsense, right? Like, I know guys that are just like, one of our family friends was a urologist in Iran. He trained here and then he was a urologist in Iran. And then he came back to America and he doesn't do surgery anymore, but he still clinically sees patients. He's like 96. He looks amazing. He's always dressed like a G. And God, I'm like, he's 96. My mom's like, yeah. I'm like, no way. I mean, and the man has worked hard and done well. He wouldn't have to work another day in his life after whatever age he was. He kept working. He does it a couple of days a week. So you can work forever if you want to work forever. You can do something else after a certain period of time. Just have fun the whole way along. Keep laughing, keep smiling. And if you find something keeps you from laughing or smiling or makes you unhappy, throw it in the trash and run away. Throw it in the trash and run away and be happy, guys.
Perfect. So before we end it, do you have anything else you want to tell the audience, whoever's watching?
Yeah, I think that the key to a harmonious society and your individual success is the willingness to work hard and put in the work and be individually responsible for yourself, but also recognize that, the world's bigger than you as an individual, and be willing to make decisions that on occasion aren't good for you, aren't good for the me, but are good for the we, and talk to people, exchange ideas, exchange information, educate yourself on topics that you're ignorant about, and become informed and understand the plight of that person who's more or less fortunate or different than you, and then work to maintain your own individual goals, but also understand that, sometimes you need to do things, or we need to do things that help those people that need the help that they can't get, whether it's your patient or your family or that underserved community without access to healthy food or access to healthcare or access to certain types of knowledge. And be willing to admit that you're wrong. And when you have confirmed that you're right and you genuinely believe in something and it's reasonable, push for it.
Awesome. Well, thank you so much for taking the time to sit down with us. I'm glad we figured out the 7 a.m., not 4 a.m. part. So it worked out.
I'm sorry, guys. I was like, I can't do it. I'm going to have to bail. I'm like, I can't wake up at 4 a.m. Plus, my wife would kill me. She'd be like, what are you doing? 4 a.m. Go to sleep.
What is it, CNN? No. So we appreciate you taking the time to join us. And we want to thank everyone that tuned in. My name is Nima.
My name is Aaron.
And thank you for accepting our invite.